Recently, it's become a bit of a fad to talk about creative people like, actors and musicians and authors and stuff as mining their trauma for your entertainment. And it's true. I've done it too, and I'll continue to do so. Telling a compelling story requires conflict. Conflict causes trauma, so that's what we do. But among creative people, artists and musicians and authors and directors and so forth, there is definitely a much higher rate of mental illness and addiction. From Stephen King writing Cujo while he was all coked up to James Hetfield, who he got out of rehab recently, and I guess they finished their album and went on tour. And yet, whenever people go to treatment, there's still a stigma. Like I've had people say, "Well, you're the one who's been in the mental hospital." Yeah, maybe you need one. In rehab, we had this guy in particular that I remember. He talked to his wife, and she said, "I'm here taking care of the kids and the household and everything while you're off on vacation." No, no, if you do it right, it is not a vacation. People back away from you while you're in treatment. And the truth is, they don't know what it is. They don't know what treatment is. They don't know how it works. So they don't know how to support you. And there's some other things blocking them from helping when you tell them what you need. This isn't a lot different from other diseases either. I had a really close friend that I lost from cancer a few years back. We met in a divorce support group where she was separating from her husband because he couldn't handle the mental load of taking care of his wife with cancer. So he was off doing things that ruin a marriage. I'll let you try to imagine what those are. And the funny thing is, she was in remission when I met her. So let's talk about it. What is treatment? Asking the question, what is treatment, is useful, and I will be answering it here, don't worry. But understanding the answer to that question is going to require first understanding the answer to this question. What is mental illness? I start with easily the thing I hear the most when I talk about mental health issues. I've been struggling with depression, I'm feeling bad, whatever, and someone says, it's all in your head. Yes, good job. That's where I keep my brain. Curiously enough, if you say, hey, I'm in a great mood, nobody says, that's all in your head. The thing is, all of your thoughts, your feelings, and your behaviors exist in a physical form in your brain. Now, I'm not a brain expert, so I'm really only going to be able to talk about this in a very primitive way, but that's fine, because you don't need a deep understanding of brain chemistry to be able to understand how treatment works. So all of these thoughts and behaviors exist in the form of neural pathways in the brain. And so understanding that, we can give mental illness a general definition. It is a collection of ineffective and or unhealthy thoughts, feelings, and behaviors. It's a very simplistic definition. When you start digging into specific illnesses, depression, PTSD, bipolar disorder, borderline personality disorder, schizophrenia, that definition applies to all of them, but obviously these are all very different diseases from each other. But because all of your thoughts, your feelings, and your behaviors exist physically in your brain, that means that mental illness is a physical illness. It exists physically in the form of those ineffective neural pathways. When we understand mental illness as a physical illness or disease, we can use the same language we use when we're talking about other diseases. In particular, we can talk about a disease existing in an active state versus an inactive state. So that's what treatment is. It's the process by which you change the state of disease from the active state to the inactive state. So that's it. I answered the question. Click like and subscribe. See me on Patreon. And of course, that doesn't exactly answer the question. You probably only know slightly more now than you did before. So how does treatment work? Since the heart of all mental illness is neural pathways that have been carved into the brain, treatment is about rewiring those pathways. rerouting around some when you can, incorporating some of them into new pathways when you can. This is all built on the concept of neural plasticity, which is basically the physical process through which your brain changes physically over time. And it's really important that you understand that treatment changes the physical structure of your brain. Now, it doesn't move like your hearing processing to a different part of the brain. It doesn't do that. But a lot of stroke survivors talk about having to rewire around the damage. It's basically the same thing, except that in mental illness, there usually isn't direct brain damage, although there can be. There can be. So the current gold standard of treatment is called dialectical behavioral therapy, or DBT. And since that's the kind of treatment I've had, that's what I'm going to be talking about. DBT has three parts, essentially, some of which come from the older cognitive behavioral therapy, which has the unfortunate abbreviation of CBT. So here are the three parts. You've got behavior chains, mindfulness practice, and effective communication. And that's treatment. Now, you'll notice that we use the word effective when you would typically prefer to say healthy. That's because if we say healthy, then we're also going to say unhealthy, and then someone who's, mentally ill is going to say unhealthy as a judgment, and they're just going to be acting out. So we go with effective versus ineffective. I'll talk more about what that means in a bit. But first, let's start with behavior chains.
All right, so this is a behavior chain. The one I'm going to work through is one that happens to me fairly regularly at work. Now, I do have a full-time job. I work in auto parts. I sell auto parts. In a previous life, I was a mechanic. I have fixed a lot of cars. This means that I know more about cars than like 95% of our retail customers. Yeah, somewhere around 50% of our commercial customers. As you can see here, we have a precipitating event, physical reaction. Then we're going to name that feeling. This box we'll go into in a minute. We're going to describe your thoughts in the moment. Then we're going to talk about behavior. And then we're going to ask the question, was that effective? So in my job, I frequently get people saying, you're just a parts guy, trying to say that I don't know what I'm doing. Now, when this happens, I get some, racing pulse, little hot-headed feeling, shallow breathing. So given that, what feeling does that describe? Now, one of the things that we particularly struggle with in treatment is understanding that the physical reactions we have to feelings are the same. So if I get angry, the physical reaction I have when I get angry is going to be the same as you have when you get angry. If I feel anxious and we start talking about, feeling suffocated or whatever, you will have that same reaction when you are anxious. This has been proven. There's no such thing as I feel my feelings my way and you feel yours your way. No, if that's what you're saying, what you are doing is mislabeling your feelings. So let's put a correct label on this feeling, because I have just described anger. Now let's put a magnitude on it. Typically, we do a number between 1 and 10. If the magnitude was 0, we wouldn't be doing a behavior chain because there wouldn't be a feeling. So it's got to be between 1 and 10. As kind of an informal standard, we say anything 7 and above means you are dysregulated. When you are dysregulated, you engage in behaviors. That's your acting out behaviors. That's when you get mad and punch the wall, or you get really anxious, and so you, I don't know, start interrogating your significant other to try to understand what's happening. That's anything 7 and above. So normally, because I actually have a generally healthy reaction to that, I'll feel the anger at about a 2. It's not real high, It's not non existent. And of course, my thoughts. Here are my thoughts. I know more than you. I have forgotten. Let me spell that right. Forgotten more about cars than you will ever know. These might be a little arrogant. Not as much arrogance as you might think, but there is definitely some arrogance here. So, what's my behavior? Um, it really depends on the customer, to be honest. It also depends on what their problem is. Uh, Clearly state that I know the answer to their problem. And now the big question, is this effective? Yes, actually, it is always effective, regardless of how the other person responds. The reason it's effective is because it meets my needs to tell them that I know what I'm talking about. And if they respond favorably, that means I will be maintaining or enhancing a relationship. Now, it's a business relationship, so it's not, I mean, those can be important, don't get me wrong. I have some very important business relationships right now. But your average person who just comes in that I'm probably not going to see again, yeah, it doesn't really matter what kind of relationship I'm going to have with them. At the end of the day, I'm going to sell them what they ask for. But this is behavior chain. Simply working through a behavior chain will actively rewire your brain. And so the more you do it, the more effective it is.
When the answer to the question, was it effective, is no, you have to do a second behavior chain where you'll describe an effective behavior, and then if it's at all possible to engage in that behavior, you do that. So you could call someone up on the phone, hey, remember that crappy thing that I did? I'm sorry about that. I should have said, I'm really grateful or whatever. Um, and this is part of how behavior chains rewire your brain so that you don't go down the ineffective pathways. Because remember, every time you go down one of the disease pathways, you refresh it and you make it stronger. Every time you go down a different pathway instead of that one, you make the new pathway stronger and the old one starts to languish. Now, the goal here with behavior chains is to get to a place where you can do them in your head. And ultimately to a place where you can work through them in real time. So that means when a precipitating event happens, you're immediately doing the behavior chain, you're identifying the coping skills you need to use, you're changing your thoughts to match the feeling, which matches the facts now, and finding an effective behavior to engage in. And this is where effective matters, because behaving effectively means that you're making sure your needs are met while you're maintaining or enhancing your relationships. A lot of ineffective behavior either doesn't get your needs met while you're maintaining or enhancing relationships. So this would be someone who avoids conflict and doesn't represent themselves in a relationship, and so they're always caving to whatever you want or whatever. That's ineffective because their needs aren't being met. There's also people who will go ahead and act out. They'll get their needs met, but they will hurt people in the process. And typically we call those people selfish. Well, they're not being selfish. Maybe they have a disease. Now, there's a lot more to talk about here because there's a huge educational component. So when you're in treatment for 4 hours a day, 4 days a week, which is a pretty standard intensive outpatient program, so you're there 4 hours a day, 4 days a week, you'll only spend like 2 hours doing, you'll spend like half an hour doing a behavior chain maybe. And you'll spend a couple of hours just talking, but then there'll be a couple of hours where the therapist is basically lecturing you like it's a college class, where they're teaching you all this other stuff. They're talking about different coping skills that have been studied rigorously by science and they actually work. And they're talking about, cognitive distortions, grief, shame, the 4 F's. I mean, there's all these things they're going to talk about, and they only have 4 to 6 weeks to cover the whole thing. And so you have to treat it like it's a college class. So if you're there 4 days a week, 4 hours a day, you need to be spending an hour a day, 7 days a week studying like a college student, like sitting there and slaving over a behavior chain every day and going back over the handouts you're given. I mean, you really have to work. And because rewiring the brain takes energy, you should be tired. When I went to rehab for the first 2 weeks, at least, it's more like the first 4 weeks. I went to bed exhausted every night because of how hard I was working on this stuff. I was there for 90 days, so the load got lighter over time. But yeah, it's a lot of work. Mindfulness practice. I love this one because I've been seeing articles lately about how mindfulness practice is making people more selfish. They're doing it wrong. Mindfulness isn't about becoming more self-aware. One of the problems with any given mental illness is we're probably already too self-aware. No, mindfulness is about living in the moment. See, when you're angry at something that happened in the past, but you're angry in the present about it, that's resentment. And this thing that happened in the past that you can't change is now ruining right now for you. If you're afraid right now about something that may happen in the future, maybe you have some control over it, maybe not. Usually you don't. That's why you're anxious. Well, being afraid about something that may happen in the future, obviously that's anxiety. So the solution to both of these problems is to focus on living in the moment that you're in right now. And that's what mindfulness is all about. Now, there are lots of ways to build a mindfulness practice. And you'll talk about a lot of them in treatment. One of my favorites is that I like to tell jokes. In order to be able to tell these jokes, I have to be living in the moment, paying attention to what people are seeing. And so I'm taking you seriously. The fact that I'm telling jokes about whatever you're saying or I'm riffing off of you, it doesn't mean I'm not taking you seriously. It means I'm paying attention to you and I'm processing the information. At some point I'm going to come back, with a response. That's not going to be a joke. It's going to be a conversation you're trying to have with me. But there is one tried and true practice for mindfulness that has existed for thousands of years, and that's meditation. And to dispel a quick myth about meditation, you're not supposed to feel relaxed when you meditate. You might, that often happens, but that's not the point. The point of meditation is to train your brain to slow the hell down. Instead of going 0 to 100 and nothing flat and getting all dysregulated, getting angry and punching a wall, meditation trains your brain to stretch that time out and to lower the magnitude so you don't get dysregulated. You still get angry because you probably should be angry, but it'll slow it down and buy you precious time to use your coping skills from your behavior chains and to do the behavior chain and find a suitable behavior, something that will be effective, that will meet your needs while maintaining and enhancing your relationships. Now, meditation isn't the only thing you can do. I mentioned that already. But it is one of the most effective things you can do. Now, when you meditate, typically you focus on your breathing, and that kind of brings your attention to right now, and you're just focused on right now. Thoughts are going to appear, but you want to be outside them, and you just want to observe them, non-judgmentally, and if necessary, with compassion. Now, with practice, your previously cluttered thought processes will achieve a clarity that you maybe never had before, making it easier to focus on finding effective behaviors. Your emotional response will slow down, as I mentioned, and the magnitude of your emotional response will drop. As an added bonus, you also unlock a lot more of your brain's potential. This is the difference between, say, you're a mechanic and you have a well-organized toolbox. So a car comes in, you're going to work on it. You can find all the tools, you do the job quickly, no problem, right? Compared to the unorganized mechanic who just has a big box with all his tools just tossed in there. There's trash, there's random crap in there. The car rolls in and you got to shuffle around looking and you get distracted and it just takes a long time to do the job. That's what meditation does, but for your mind. Effective communication. Now this is the soy sauce and stop part of treatment. When you mix everything together and you put it into practice. Typically, this is done in a group setting where you'll talk about things with relatively low stakes. So, for example, you can just assume when you walk into an IOP or a rehab or a mental hospital that over half of the patients have been sexually assaulted. But you're not going to talk about that in group because that's something that needs to be processed one-on-one with a therapist. But you may talk about something adjacent to that, like I don't know, someone told you should smile more. You talk about that in the group, and you might even do a behavior chain on it, and that will help you later to be able to deal with the much harder topic when you're one-on-one with your therapist. So generally, instead, you're talking about your day or your week or whatever, and there's specific things that people are going to do in this conversation. Whenever you try to pass a judgment off as a fact, it's up to the group to identify that it's a judgment and to ask for the facts. And then, then they'll ask, does the judgment fit the facts? If it does, fine, go on. But you will not be able to pass off a judgment as a fact, because a judgment is ultimately your opinion, and opinions are not facts. This is also how you identify cognitive distortions in real time, and you will practice doing that, not just for yourself, but also for the people around you. Whenever people discuss their emotional reaction to something, we're going to ask, does it fit the facts? If necessary, we'll stop and do a behavior chain as a group. Everyone gets a chance to talk, and this is often referred to as a check-in. And depending on the group, usually it's done first thing when you walk in. And then you'll move on to what I was talking about before, the college lecture style class. Some people will do the lecture first, the check-in last. I have seen that. Now, when you're in a program that lasts, the last 4 to 6 weeks typically, you can sometimes, depending on what your insurance is willing to pay for, you can get into like a 90-day program. You can even get into 6-month residential. These things are available. They're harder to get into, of course, so your typical program is 4 to 6 weeks. But you will see people changing over time. So you might have someone who's acting out a lot the first couple of days there, but 4 weeks later, they're reasonably peaceful and serene because the therapy does work. Now, once the program's over, and you have to continue doing these things without the help of the therapist and without the support of the group, it gets harder. That's where support groups come in. Talk about that in a minute. This check-in is moderated by a therapist. So the therapist will frequently interject to give actual scientific explanations for whatever you're talking about. So, for example, I have been in a relationship where I just didn't have the money to leave. In order, if I left, I was going to be homeless. No food, no nothing. That's Maslow's hierarchy of needs. And, well, that happened. Therapists would talk about it. So that's how treatment works. Now let's talk about prognosis. Mental illness is just like any other disease, where the earlier you catch it and get treatment, the better your chance. Unfortunately, our social narratives are literally the opposite of that. Addicts are often told that they have to reach their lowest point before they can get help because it won't be effective before that. And this is a problem because it is effective if you participate, and with opioids in particular getting more dangerous year after year, we're in a situation now where the addict hasn't reached their lowest point, and they're not going to because they died of an overdose. How are they supposed to get treatment if they die before they reach their lowest point? And for addiction in particular, treatment is a race. You're trying to get as much treatment as you can, have it take effect before the drug kills you. For any mental illness that is serious enough to require treatment, that means it's going to be a chronic, lifetime medical condition. You're going to have this for the rest of your life. One round of treatment is probably not going to be enough. It can take years of working on it. You're going to be in and out of mental hospitals and treatment programs before you're finally going to be able to live without the illness. And I can't stress enough, this takes years. I've been dealing with depression since I was a kid, and addiction for the last 12 years. It's been 5 years since I got out of rehab, and I'm still not out of the woods. I probably need more treatment. It's frustrating and it's scary, much like when your doctor tells you that cancer is coming out of remission and you're probably going to die. The main difference here, though, is that mental illness manifests itself through behavior, often self-destructive behavior, hurting the people around you. And we always try to see that behavior as a choice, like you could choose to behave differently. It's difficult. We don't really understand that it's not a choice. Even people who are in the middle of it, who are doing things that they feel like they have no control over themselves, still think they're choosing. You can't choose your mental illness. If you could, I would have picked something a lot more fun than depression and addiction. Like, I don't know, Tourette's or multiple personality disorder. I don't know, something much more fun. And while you can't choose your mental illness, you can choose treatment. You just need to understand that it is a lifelong commitment. Once you start treatment, you can't stop. You're going to be doing behavior change for the rest of your life. You're going to be meditating for the rest of your life. But this is why we have support groups. Now everybody knows about AA. There's also NA, Smart Recovery, Recovery Dharma, Life Ring. I think Refuge Recovery is still around. There's a few others. There are also support groups for other mental illnesses. So you can get a depression group, you can get a bipolar group, whatever. There are support groups for grief and divorce and all sorts of things that come up because we can't do it alone. Unfortunately, we're oftentimes surrounded by people who can't help either. So show them this video and see if maybe they can find ways to be more supportive. Thank you for watching this video. If you like it, please like and subscribe and ring the bell. You know the drill, like you do on every channel. If you'd like to support the channel directly, you can join my Patreon. It's just $3 a month right now, and I'll put your name in the credits. There's no credits right now. I think you know what you need to do. Of course, I am a science fiction writer. That's the whole point of the channel. You can go to Amazon and you can buy one of my books. That will also directly support the channel. Of course, links are in the description. Blah, blah, you know this. Everybody else says most of the same things, but I say it better.